Hi everyone, my name is Dr. Joe Reel and I'm a general pediatrician in Cincinnati. Lately we've been getting a lot of questions from families about the coronavirus outbreak. So over the last couple of days we've collected some questions from families in the community and we're hoping to share some answers today. So our first question, with allergies now taking off, how can we calm ourselves in knowing what is truly a symptom of coronavirus versus allergies? So that's a great question, especially for this time of year. So allergies tend to present with certain symptoms. These can include itchy, runny eyes, runny nose, and sneezing. Now we're still learning about how coronavirus presents in children. We know a couple of things. It tends to present with cough, fever, and trouble breathing. Now with allergies, you wouldn't expect someone to have fever or trouble breathing from allergies on its own. So, if you notice that your child is having trouble breathing, that makes me think it's probably less likely allergies. So I'd want you to give your pediatrician a call so that we can get a little bit more information on what's going on. Okay, next question. So why can't everyone get tested for the virus just to be safe? So another great question. So testing is a complicated issue. So I think when most of us think about a test, we think about like a flu test or a strep test. So you go into the doctor's office, you get your strep test, and you know pretty quickly whether or not you have strep. So it's not quite that simple with the coronavirus. This is a new virus, right? So we haven't seen it before, which means we're developing new tests in order to identify that virus. Now, a coronavirus test requires a whole bunch of things. You need special kits, you need chemicals to transport the test from a patient to a lab, and you need other chemicals in order to actually run that test. So big picture, it is hard to run a coronavirus test, and there's not a lot available. So we're really prioritizing testing in areas of the country where there's a lot of illness. So areas like New York City or Washington State. So in the future, we could certainly have more testing to help us understand where coronavirus is in communities. But since it's a limited resource right now, we're really focusing on areas of the country that really need it. All right, so next question. This one also has to do a bit with testing. So why are they only doing tests on patients that have been around someone who tested positive? My son had a fever to 101.1, cough, sore throat, and a pink eye, and was only tested for flu and strep. So I can definitely understand how this situation can be frustrating. But we just discussed, how coronavirus testing is complicated and there's not a lot of tests available. So in Cincinnati, we are focusing on testing those kids that really need a test. So that's going to be primarily kids who are in the hospital. Kids who are sick enough to be in the hospital, it's really important to know whether or not they have coronavirus. The reason is because it lets the medical team, it lets the doctors and the nurses who are caring for that patient know if they have coronavirus so they can plan appropriately. It also lets us know what type of isolation a patient might need so that we can help prevent coronavirus from spreading to other patients in the hospital setting. Now, we are lucky to know, based on everything we've seen so far, that kids overall tend to do pretty well with coronavirus. So, when I'm in the clinic, I'm seeing patients with fever and cough. Is it a possibility that a patient with fever and cough might have coronavirus? Yes. Is it more likely that a patient with fever and cough might have another type of cold virus? Also yes. So, does it really matter? So for me, if a patient is well enough to go home, they don't need to go to the hospital, it doesn't make a big difference to me whether or not that patient has coronavirus or not, okay? I'm gonna treat them the same way. So I'm gonna let their parents know that they should get lots of rest, they should get fluids, they should use Tylenol for fever control, and I'm also gonna tell families what to watch out for, because that's the big point here, right? I'm gonna tell families that if they notice their child starts to have trouble breathing, that I would wanna know right away. So, the good news is that we're already having families stay at home, we're doing social distancing, And these are all great strategies to help prevent the spread of coronavirus because, again, it is really hard in kids to tell whether someone has coronavirus or whether they have your typical cold virus. All right, so let's go to our next question. So how does the virus spread? So coronavirus is thought mostly to spread from person-to-person contact, okay? So that typically requires close contact between individuals, which is why we're recommending that when you have to go out in public, that you want to make sure you're trying to remain at least 6 feet from individuals who live outside of your household. So coronavirus is spread through something called respiratory droplets. So those are produced when you cough or when you sneeze. So some other strategies you can use to help keep your family healthy and safe is you want to encourage your kids to cough or sneeze into their elbow, okay? You want to have them be washing their hands with soap and water often, and you really want to help them, encourage them to avoid touching their face, okay? Because touching your eyes, your nose, your mouth, those are easy ways for a germ to get into your system. Awesome. So let's go to our next question here. So how do we do mindful exercises to help from feeling overwhelmed? Any ideas about self-care for patients or for parents who are already feeling overwhelmed? So this is a really great question. So I think this is a stressful time for all of us, and we all respond to stress differently. I think what you're doing right now, watching a video about coronavirus, is great, right? So you're getting some education, learning about what you can do to help keep your family safe. But if you look at TV, if you look at social media, it is constantly talking about coronavirus, and sometimes that can be a little overwhelming. So for me, what I did was I really tried to set some boundaries around when I watch the news or when I go on Facebook, just to create some separation between me and that constant barrage of coronavirus information. So some other things I'd recommend is trying to get enough sleep at night, eating healthy if you can, trying to do a bit of exercise. Setting routines, that's something else that can be really helpful. That's both helpful for adults and for kids. So setting a routine, but definitely making time for doing things as a family that you enjoy. One of the most important things is going to be talking with people you trust. So we're all kind of taking care of each other now. So talk to your loved ones, check in on them, let them know how you're feeling. All right, so last question here. Will our children overcome this? How can we make sure that our children are thriving through this process? So kids are resilient, and kids will certainly overcome this. And you can make sure that your kids are thriving by doing things like you're doing right now. So you're watching a video about how to keep your family healthy during this time, and that's just fantastic. Cincinnati Children's has also posted some resources online to help families since the coronavirus has really disrupted, a lot of individuals' daily life, things like school and work. So in order to access that, you just need to go to the Cincinnati Children's homepage. There's a banner at the top that says questions about COVID-19. That's another name for coronavirus. And you can click on a section that says what families and patients need to know, and then there'll be a selection under that called Family Resources. So I think that's enough information for now. Remember, we are all in this together. Keep up with your good hand washing, with your social distancing, and please give your pediatrician a call if you have any concerns or questions, especially if you notice that your child is all of a sudden having some trouble breathing. All right, that's it for now. Thank you so much for listening. Bye-bye.